Dr. Mohebi from Parson Mohebi Hair Restoration. We have another consultation day, and we're going to go over some of the patients, the results, and what to be expected after. A middle-aged gentleman with class 6 of hair loss, no hair in front and top, and views the top area. We had to cover a big area of the scalp, so he ended up having a 2 FUE hair transplant. Obviously, a big area to cover. Microscopic miniaturization study, he had 100%, 90% front and corners. On top and crown, he has 70% miniaturization, meaning that he's class 6. Size of the balding area, at times we have to do 2 procedures, especially with FUE procedure, we cannot get more than 2,000 grafts. So anything more than that, it has to be planned in 2 days. FUE procedure, the one that we individually remove the hair from the back and that doesn't have any scar, any pain after procedure, is more limited. That bigger procedure needs to be done in 2 days, sometimes more than that. This gentleman got 2-day procedure, and we're going to review the results. The first day we covered the front and corners with about 1,500 grafts. Another day following, we covered the top areas. We gave him a same number of grafts, about 1,500 grafts, that was spread in a bigger area of the scalp. We did not cover the crown area. So this is him 6 months after procedure. Nice full density, front, corners, everywhere. And as we go to the top, we see that certain areas he doesn't have as much density, the crown, because we didn't put as many hair. He probably need another procedure. Compare these 2 pictures. We see the big area was covered. He has a nice coverage, although you still see the scalp because of his fine hair. But despite of that, his coverage is pretty good for only 3,000 grafts. This is a side view, again, after and before hair transplant. He doesn't have much hair, very limited on top and front, and these are all transplanted. Top and crown, these areas are the ones that we have to focus in the future. He needs another procedure, maybe 1,500 grafts here, another 500. Inspect the front and this area because you always comb from side to side, so everything on this side will cover the other side and add to the overall density of the scalp. Is a class 6 patient with obviously big area of hair loss, the whole top, front, even the temporal lines were receded, and we restored everywhere. With only 1 hair transplant, we give him 4,600 grafts in only 1 session. That was a strip procedure that gave us have to achieve all of our goals in only 1 procedure. And before the procedure, you see he does have just a little bit of hair on the top. The front is gone. The temporal points are pretty much like concave. Points are very important. These areas that you see the hair is coming forward from the side, burn forward. In the youthfulness of the patients are getting hair transplant, the front is restored, but the temporal points are not perfectly done. And then when you look at them, something is not right. And at times they just look older. That becomes especially important when people have narrow chins and these temporal points are going back. The face becomes like bulb shape, which adds to the age of the patients. Before the procedure, you see the whole top and temple and crown is bald. Day 1 after procedure, you see the hairline. You see how irregular the hairline is. The temporal points are filled, and the top and crown with a reasonable number of grafts were filled. 12 months after procedure, you see how perfect the hairline is. Of course, it could be denser and fuller with more hair, but this is good enough for this patient who is class 6, so basically completely bald in a big area of the scalp. The whole front is dense and the top areas. What you can see is the result of a giga session hair transplant. He received 4,700 grafts in a big area of the scalp, and this is. You see the temporal points and how they're filled here after procedure, and hairline, how he didn't have any hair, and now he has a solid hairline. Another view is the extent of hair loss and the coverage, which is perfect for only 1 hair transplant. He needs more hair transplant in the crown area. We talked about it, and he's going to plan on scheduling it soon. Patient, again, another class 6 patients. The whole front is gone. The whole top and front is pretty thin. On different angles, the crown is bald too. So we did a big procedure covering the front and corners and crown areas. How he looks a year after his procedure with a reasonable coverage. Big area of the scalp has been covered. And also had a giga session hair transplant, 4,093 grafts, 320 singles in front, 2,000 just to do the front and corners. 1,000 grafts on the top area and the rest less than 1,000 on the crown area. Compare these pictures. Again, this is amazing result for the coverage of a big area of the scalp with over 4,000 grafts. Procedure from here to here. You probably need more reinforcement of the crown, maybe a little bit of reinforcement in front, but he's pretty much done and the baldness is gone. We reviewed some 6 months and 12 months follow-up after hair transplant. Now let's look at a immediate 2 weeks follow-up after hair transplant. And who had a hair transplant 2 weeks ago, you see the front and corners were thinning and receded, and we restored those areas. Here's the day procedure, the front corner. We covered with a good density, and this is another angle. 2 weeks after procedure, of course, you see a lot of scabbing here that we don't expect to see. At this point, the scabs should all be gone. Those scabs, we know patients haven't been washing their hair properly, so we give them instructions and leaving the shampoo longer. At this point, they should just see a preview of future hair transplant with like shorter hair, but the scabs should be completely gone. So we ask him to wash his hair more aggressively, keeping shampoo longer. Next patient is a young gentleman from 3 months ago who is worried about whether or not his hair is growing. Scheduled patients after the first 1 day and 2 weeks follow-up. We scheduled them for 8 months follow-up to see the earlier growth, and reasonable for that we don't want to see them earlier is because some people don't even see any result before 5 or 6 months. Out of all of these patients are coming back to us worried about whether or not their hair is growing. Let's look at his pictures and see what should expect at this age. And had hair loss in a big area, but he has a little bit of his own hair still remaining in front. Corners are almost gone. The corners are gone, a little bit more hair in front. We restored everything in front and corners, of course. How he looked right after procedure. We shaved his head for this case, and this is another angle. What he sees now at 3 months, which is pretty much the same as what everybody should expect at this point. You see, the front he had some of his own hair, but the corners was all bald. Now we see some hair growing on the corners and some on the top, but it's hard to know which one is new hair, which one is his own hair. So at 3 months, that's pretty much what we see. A lot of patients have a lot of anxiety. They're anxious to see the result and to see how it looks, but some people don't show any result before like 5 or 6 of 3 months follow-up. Let's look at this 2 weeks follow-up that the judge just saw him. We did the front and corners views of the corner, and this is exactly what you expect at 2 weeks. So he did a good job with hair wash. It's nice and clean. There's no scabbing. That's what you can expect in 2 weeks after procedure. The transplant areas are looking very natural. Might have some mild pinkish discoloration still. Most of the hair, transplant hairs are still there, and most people, like more than 90% of them, will lose them all and then start growing them after 2 or 3 months. 2 week follow-up. This is a remote consultation. These are the pictures we took in our office before the procedure, and this is right after procedure. What you expect to see right the day of procedure or the day after procedure, like little whitish spots. This is the new hair that's going to be growing in this area. And this is what I captured from Skype that he was trying to show me. 2 weeks after procedure, scabs are gone, but the hair is still there. Are usually keeping those hairs for 2 or 3 weeks, and then they lose them all, and they go exactly to where they were before. Early growth is expected at between 3 to 6 months, and full result anywhere between 2 to 12 months. Some people even need more time to see full result after hair transplant procedure. Those are our consultations from our consultation day that I shared with you. This is Dr. Mohebi from Parsa Mohebi Hair Restoration, wishing you a happy hair day.